While the present global shift towards limiting SARS-CoV-2 transmission is recent, infection prevention and control characterize long-standing pillars in dentistry. COVID-19 is an acute respiratory disease with varying symptoms, including coughing, headache, fatigue, diarrhea, fever, difficulty breathing, or loss of taste and smell. This disease can affect and be fatal to everyone regardless of age, sex, or health status. However, immunocompromised individuals are more susceptible to the fatal consequences of COVID-19. Severe acute respiratory syndrome, coronavirus 2, or SARS-CoV-2, is the virus, while COVID-19 is the resulting disease. The greatest transmission risks exist close to symptomatic onset, and there are currently 3 generally accepted routes of transmission. One is through contact transmission, where an individual touches their eyes, nose, or mouth with virally contaminated hands. The second is droplet transmission, where droplets or liquid particles greater than 5 microns enter the human body. The final vector of transmission is through airborne aerosols. Aerosols are liquid particles less than 5 microns that can stay suspended in the air for a relatively long duration, leading to longer exposure times. Aerosols can be created by coughing, sneezing, talking, breathing, and aerosol-generating procedures in dental practices. As aerosols are such an important vector of transmission in the dental practice, the Scottish Dental Clinical Effectiveness Program has laid out 3 categories of aerosol generation. Class A aerosol generating procedures use high-velocity instruments that will without a doubt generate aerosols, while Class B aerosol generating procedures have the possibility of producing aerosols through the implementation of low-velocity tools. Finally, Class C are aerosol generating procedures that do not implement power tools. Therefore, they have a very low possibility of generating aerosols. However, they have a chance of producing droplets through splatter creation. In addition to the standard cross-contamination and infection prevention procedures, prophylactic measures between classes vary in additional PPE, fallow time, and airborne aerosol reduction strategies.
Despite dental care's critically high risk of transmission, the Dental Council outlined vital elements for containing this threat in response to the pandemic. The first key element is vaccination. Dentists are expected to encourage patients and staff to get vaccinated as soon as they become eligible. However, the Dental Council also references the Infection Prevention Control's interim guidance for the HSE. This guide mandates the identification of healthcare workers who refuse to participate in vaccination programs and to exclude these caregivers from the workplace. Necessitating employment termination of non-compliant employees is problematic, as dentists may lose integral and productive members of their team should they reject the vaccine. Be that as it may, there is growing evidence that vaccination not only protects against the disease, but also diminishes the risk of becoming a transmission source. The second key element is limiting footfall. Dentists are instructed to discourage unnecessary attendance at the practice. Nevertheless, substituting routine checkups with telephone appointments abolishes the practice of preventative dentistry. Dentists were also advised to limit a single individual's total visits by performing any and all treatments that can be safely done in a given visit. Although completing multiple treatments in one sitting would reduce the propensity of daily interactions, a single sitting is insufficient for more complex treatments such as those requiring indirect restorations. A survey published by the Irish Dental Association quoted how this unprecedented crisis poses a grave threat to the nation's oral health. These threats infringe upon the sustainability of dentistry in many ways. For instance, a survey conducted by the U.S. Surgeon General revealed a 78% annual increase in e-cigarette usage amongst high school students during the pandemic. It is seemingly during these times of anxiety that most people resort to unhealthy, self-soothing habits such as binge eating and smoking. The increased prevalence of these risk factors comes at an undesirable period where dentists can help them the least.
The decline in operator time resulting from COVID-19 protocols is also worth noting. Dental practices are uncertain about the availability of staff on any given day, since employees may become quarantined on account of confirmed exposures or emerging symptoms. Such circumstances may result in the loss of operative days in their entirety should they have to close. Furthermore, practices have been advised to space out scheduled appointments in a manner that prevents encounters between sequential patients. Lastly, treatment durations have become elongated in the following domains. The first domain is during pre-treatment, where time is consumed awaiting the results of antigen tests. The second is post-treatment, where enhanced cleaning procedures and necessary fallow times collectively result in delays. The extended operative times ultimately culminate into reduced financial income for the practice. Although larger practices can survive transient periods of low revenue, the IDA survey estimates that 80% of private practices are currently unsustainable. This survey also reports how 86% of private practices were forced to lay off staff during the pandemic. With increased costs due to necessities like PPE, many smaller new practices may close indefinitely. To conclude, here are 3 key takeaways. 1. Aerosols. Aerosol generation was a considerable pre-existing concern in dentistry. However, in light of COVID-19, aerosol generation has grown into a substantial threat. 2. Operator time. To prevent viral compromisation of dental practices, specific interventions such as antigen tests and fallow period limited dentists' total operating time. 3. Sustainability. At this rate, doubts arise as to whether dental practices in the future can maintain pre-COVID levels of patient care and productivity.